All right. This lesson is over harmful effects of tobacco by Michael Maven, which is me. Um, for our, well, if we was in class today, for our bell ringer would be, to write down 5 things that you learned from John's previous lesson. Uh, Basically, what we would be going over, once y'all got y'all's bell ringers done and everything, 5 things we basically would kind of be going over is he explained basically what tobacco is, which is a plant that someone smokes to relieve stress or to fulfill personal enjoyment. He also went over, different types of tobacco, such as cigarettes, dip, chewing tobacco, cigars, uh, pipe tobacco. He also kind of went over, how it is used also as well in his lesson. um, here are some harmful effects of tobacco on the respiratory system. Irritation of the trachea and larynx, reduced lung function and breathlessness due to swelling and narrowing of the lung airways and excess mucus in the lung passages, impairment of the lungs clearance system, leading to the buildup of poisonous substances, which results in lung irritation and damage, increased risk of lung infection and symptoms such as coughing and wheezing, permanent damage to the air sacs of the lungs. Um, when it deals with, the trachea and the larynx, your voice box and your windpipe, uh, once you do enough drugs, um, your voice it actually can change your voice, and your voice will be a little bit more raspier, if you know what that means. Uh, I also know people that that smoke that has had to have like those that they have to have like those white things like put in their neck, and it's like hanging out their neck. Um, that way they can breathe and everything. Um, as for the harmful effects on the circulatory system, um, it is raised blood pressure and heart rate, uh, constriction of blood vessels in the skin, resulting in a drop in skin temperature, less oxygen carried by the blood during exercise, stickier blood, which is more prone to clotting, damage to the lining of the arteries, which is thought to be a contributing factor to atherosclerosis, which is basically the buildup of fatty deposits on the artery walls. Reduced blood flow to extremities, which is the fingers and toes. Increased risk of stroke and heart attack due to blockages of the blood supply. Um, you so basically, if um, we'll go to the next slide. For the immune system and musculoskeletal system, you have a greater susceptibility to infections such as pneumonia, and influenza, more severe and longer lasting illnesses, lower levels of protective antioxidants such as vitamin C in the blood, tightening of certain muscles, reduced bone density. Basically, with reduced bone density, basically your bones get more brittle. So, if you're smoking a lot and, you have a bad fall, and you've been doing this, smoking for years and everything, you're more prone to possibly breaking a bone. Um, as for tightening of the certain muscles, if your muscles get tight and you do something and like you go out in the yard and you do something, you're prone to also tearing muscles or straining muscles. Um, but yeah, I mean, it's pretty obvious, if you smoke, you're going to have more severe and longer lasting illnesses. Uh, is and as for the greater susceptibility to infections such as pneumonia and influenza, that stuff's going to pneumonia. It's going to get in your lungs, and it's going to. As for your lungs are going to be kind of clogged up, from all the smoke and everything you do, and your airways are going to be, they're going to be clogged up, and it's not going to be as easy to breathe. So it's going to be harder to fight off that pneumonia and also the influenza that you possibly might have. Also, with what's going on right now, which is the coronavirus, it's also very hard. It's also very hard for you to breathe. That's one of the symptoms. It kind of basically coronavirus. Is it feels like you have an elephant on your chest is how they're pronouncing it. So if you have, if you smoke and your lungs are clogged up from all that smoke that you did all over the years, and you get this coronavirus, you're at a high risk, of possibly dying or very serious medical. Diseases caused by long-term tobacco use. Cancer of the lung, mouth, nose, larynx, tongue, nasal sinus, esophagus, throat, pancreas, bone marrow, kidney, cervix, ovary, ureter, liver, bladder, bowel, and stomach. Lung diseases such as chronic bronchitis and chronic obstructive pulmonary disease, which includes obstructive bronchitis, emphysema, heart disease, and stroke. Ulcers of the digestive system, osteoporosis, hip fracture, poor blood circulation in feet and hands, which can lead to pain and in severe cases, gangrene, amputation. I know a lot of people that have smoked and they have poor blood circulation, like I just said, in like the feet and hands. And once like if they get like a tiny cut on their hands, sometimes that can lead to amputation. And some of these diseases combined, help, could lead to, amputation, such as like diabetes. If you have diabetes, poor blood circulation, in your feet and hands, you want to take care of yourself if you get an infection or something, because that could really, cause you to have to amputate a finger or a toe or something like that. The last one is rheumatoid arthritis. But back to the top, cancer. Basically, with if you smoke, you can almost pretty much get cancer anywhere, to be honest. I know, from experience, my grandma used to smoke and she got lung cancer, and she ended up dying pretty much after she got diagnosed with it. And I've always heard, if you don't smoke, that can, if you smoke for, your whole life, and then, I've always heard, if the people that smoke their whole life, if they didn't smoke, that, they would be probably, they probably could live 20 more years. And I actually believe that. Here's a video more in depth. This video more in depth look at, what smoking, tobacco, what all that does for you. Let's see here. Go back. Okay, well, I guess this is not working, so I'm just going to go on to the next one. Basically, what the video was basically just a more in-depth look at like what tobacco does to your lungs. I have a picture on one of the last few slides that basically will show you what your lungs will look like if if you smoke. But basically, that's what the video was over. It was a little 45-second video over that, but I guess it won't let me click on it. So we're just gonna skip that and go on to the next one. All right. We was in class today. We'd be doing group work. So basically, we would have broke up into two groups. In our groups, we would have picked, a form of tobacco, and we would have discussed what is, the harmful effects of that tobacco product and how it affects the person long term and short term. So pretty much, one group basically would have picked like a dipping tobacco, and then the other group would have picked a smoking tobacco. And they would have basically told me what is the harmful effects of that tobacco product. So pretty much, basically, if they would have said dipping a dipping tobacco product, they would have said, one of the harmful effects is, gum cancer or, irritation of the gums, and everything like that. And for smoking, you would have said, lung cancer or something like that. That would have been a long term. Short term would have been like basically bad breath for dipping. For smoking would have been like like emphysema or something like that. All right, here are three pictures of three pictures. Here on the top is harmful effects of tobacco, which is basically it shows your cancers and your chronic diseases, which we already went over. Cancers in the head or neck, the lungs, leukemia, stomach, kidney, pancreas, colon, bladder, cervix. Your chronic diseases, which is stroke, blindness, gum infection, like we was talking about, with the dips you use, heart disease, pneumonia, chronic lung disease and asthma, reduced fertility, hip fracture. But yeah, those are basically all the, and there's in-depth picture of the harmful effects of cancers and chronic diseases of tobacco. The video I was talking about earlier that I wanted to show y'all was basically showed the lungs going from this yellow lung to this black, dark, nasty lung over here. And that's basically what the video was over. But yeah, that's pretty bad right there. You don't want your lungs to be like that. As for the last picture, exposure to secondhand smoke in children. Children are at increased risk for more ear infections, can cause respiratory systems like coughing, sneezing, and shortness of breath, can cause more frequent and severe asthma attacks, increased risk of bronchitis and pneumonia. Breathing even in small amounts can be dangerous. If you're a smoker and all these harmful effects, you should really keep it away from your kids at all possible. Last would have been, I would have did a Kahoot test with y'all. And before that test, I would ask, if y'all had any questions. But leave your questions at the bottom of this YouTube video.